Hello, everyone. My name is Sadaf Adnan, and I am an occupational therapist. Can everybody hear me? If yes, you can just write yes. Just want to make sure that everybody can hear me. So today I'm here to just give some awareness about what is occupational therapy and how does it help to autism. By the way, just to give myself a little bit introduction about myself, I'm a Canadian trained occupational therapist, and I was working in Canada since last 17 years as a registered occupational therapist. I am here now and with American Wellness, and now I'm gonna just give a bit knowledge about occupational therapy and autism. Okay, so just wanted to give you some brief description. What is occupational therapy? I know everybody knows about occupational therapy, but just if few parents or teachers just joined this webinar, just to give them some brief description about what is occupational therapy. So it's basically the occupational word came from a Latin language called occupare, which means that gives a meaning to life, a purpose, a structure to help people to regulate their life activities, which can be work, play, socializing, schooling, anything, any occupation that gives a structure to a life that can be done through occupational therapy. Okay, so it's an allied health professional that involves the patient use of everyday activities or occupations to treat physical, mental, developmental, and emotional activities that impact patients' abilities to perform the daily routine activities. In a simpler words, it's a branch of healthcare, professional healthcare, that helps people of all ages who have physical, sensory, or cognitive problems. So this is a brief description about occupational therapy. Now, how the occupational therapists help. So the occupational therapists help people to regain their independence in all areas of life that affects person emotional, social, or physical needs. OD evaluates and treats people who have injuries, illnesses, or disabilities. They assist in developing realistic goals to recover or improve and maintain skills needed for daily living and working. So basically, occupational therapist helps in all emotional and social and physical needs that actually design people's life to regulate in an appropriate way. So these emotional and social and physical challenges are combined of these few things mentioned on the screen that can be fine motor, visual, motor planning, self-care, academic, play, social participation, sensory processing. Well, these are the few things which we are prioritized always in evaluation and see where the deficiencies are and where this person needs more improvement to have more independence in their life. Now, how the occupational therapist help autism? So just as everybody must known about autism too, but again, to give some more awareness to some teachers or parents or caregivers, what is autism? So autism is a word came from, now autism was a previous word, now it's been using as an autism spectrum disorder, ASD. It's a neurodevelopmental condition characterized by impaired sensory, social, communication skills, restricted and repetitive behaviors, and isolated areas of interest. Early diagnosis and intervention can greatly improve outcomes for people with autism. One of the primary mode and comprehensive care of intervention is occupational therapy for autism. So the early it get diagnosed, the better intervention and treatment plan can be done to improve the outcomes of people with autism. Now, occupational therapy is Occupational therapy focuses on improving functional abilities and enhancing quality of life by addressing challenges related to following categories. So the most focus of occupational therapists is all these following categories, which we normally evaluate first, and then try to find out where the initial problem is and how and what plan needed to treat that problem. Now, those problems are composed of these following categories, which are sensory integration and sensory-based strategies, motor skills development, social skills enhancement, emotional regulation, daily living activities. So these are some categories which we normally assess and evaluate first and see and make the treatment plan according to these strategies, like these assessment and evaluation strategies. It could be sensory, it could be motor. Motor means fine or gross motor. Gross as more bigger movements, fine as smaller movements. Fine's mostly compiled with grasping, pinching, holding, like pencil grasping, holding papers, cutting. These are all fine motor, which normally the child start their life initially with all these activities. So if there's any problem parents notice or teachers notice that kids are not able to hold a pencil properly according to his age, they should aware of these issues and try to contact the professionals to get the referrals and diagnosis and start the treatment right away. So that's how it should be. So I just want to focus more on motor skills and sensory skills. Sensory skills are mostly depending on what sensory skills are lacking. It could be hearing, it could be tactile, it could be movement, it could be space, the space in the movement in the space. It could be anything. So sensory and motor skills actually compile the basic and initial stage of child's life. If you notice anything regarding if like child is not able to hold the ball properly according to his age, if the child is not able to run and catch the ball according to his age, there is some definitely an issue behind it, and they should consult to the professionals right away. So these are the basic strategies and basic evaluation. We normally do it with the children first and try to see where the problems are lying. Other could be social, emotional, and daily living activities. Social means if they're not, if they are having any behavior issues with their siblings, with their classmates, with their family, they are not able to do any group activity together, they're not able to focus the group interaction together, or they're not able to regulate their emotions properly. If they are not listened at the timely manner, they hit, they run, they hide. These are some sensory-based issues which normally parents notices first, teacher notices first, that this child normally stay away from the group. They don't like to sit in the group, or they would not like to focus on the activity. They have their own imaginary world. If parents or teachers notice any kind of these issues, please consult with the professional, consult with the doctor. And definitely doctors are aware of occupational therapy treatment plans. So they always, if they notice any kind of issue with these developmental strategies, they will refer the child to occupational therapy. Now, what is sensory integration techniques and how we treat them? So children with autism learn to modulate their sensory experience, reducing sensory overload and promoting a calmer state of mind through sensory-based activities. Now, sensory-based, everybody knows 5 senses: hearing, vision, taste, touch, and movement. These are basic 5 senses which child experience in their early stages of life. Now, if they are having any issues, for example, touching, some kids don't like to be hugged. If you notice that, parents, if you notice that whenever you try to hug your child, they just either they stay mute or either they just want to stay away. This is a sign where you need to be more concerned about. So this is one of the sensory issues which is coming to the tactile stimulation. That means this child is not having enough tactile stimulation, or maybe he's overloading with tactile stimulation. Maybe we have to sometimes we have to provide tactile stimulation. Sometimes we have to take away the tactile stimulation. So if, for example, if the person needs tactile stimulation, which we provide, this is how we provide tactile stimulation, by maybe, for example, giving a weighted material to wrap around their hands, to wrap around their legs. These kind of weighted materials give them enough tactile stimulation so they can focus on the activity, because now they are getting their sensory diet. This is called sensory diet. When they receive the proper sensory stimulations, that means they're receiving the proper sensory diet. Suppose if you're hungry, you will not able to focus anything. You will not able to think about any project. How? Because your stomach is empty. Similarly, same thing with the people with autism who have sensory issues. So these stimulation give them sensory diet. Same way I just explained about tactile stimulation. Once they are properly tactile stimulated, they receive their tactile diet, their sensory diet, and then they are more calm, they are more relaxed, and they're more able to focus their activity. Okay. Similarly, for example, we can take another example like hearing. If a child is overloaded with hearing, he doesn't like noises. He's overstimulated with noises. At some extent, it's normal. An aeroplane is going over over your house. Sorry about that. An aeroplane is going over your house. This is the normal hearing stimulation. Everybody can tolerate, but a child with autism will not be able to tolerate that noise. This is too much noise for him to absorb, and he will try to hold his ears with his hand, or he will try to run away. He will try to hide. There's a sign now. Parents should note that sign. Teachers should note that sign. How the occupational therapist then help that child. Again, provide him a proper sensory diet regarding hearing stimulation. Normally we cover the ears so they're not distracted with the outside noise, and they are able to focus on the activity more able to focus the activity more appropriately. Okay, so these are the strategies which occupational therapist actually uses to provide the population of autism a proper sensory diet, so they are able to focus on their daily routine activities. Okay, so these were the few examples. Now there is another example written here as swinging, deep pressure. I just discussed about the deep pressure, the deep tactile stimulation, and the tactile exploration. Now swinging is mentioned here. Is how we provide sensory diet with swinging. Swinging is something that person gets relaxed easily with autism, because now when they are in their bodies in the motion, they have to control their body at the same time and focus on the activity at the same time too. So now they're learning so many things with the swinging. Swinging, they're balancing, that means gross motor is functioning, and plus some fine motor functioning, some visual activities, some bilateral, both hands activities are doing. How many things we are achieving through one single activity, which is swinging. So these are all these strategies which occupational therapist uses to provide a better environment for the autism population to be independent in their daily routine activities. Now here's a video. I would like you guys to see that video. Just a little example how the occupational therapist working with the children.
So when we have a story and a really rich play base to the activity, we're getting them in this kind of safe place where they're exploring things that they may not be comfortable doing otherwise, because they have this perception of it being too hard for them.
Hey everybody, welcome back to the Flaghouse Sensory Channel. I'm Chris. I'm here this week with Michelle Parkins here at Great Kids Place in Rockaway, New Jersey, where we're looking at some great activities that we can do on swings. Now, swings are one of an occupational therapist's best tools. Tell me a little bit about what it is that you do with the kids on the swings and why they're such an important part of what you do.
Sure. So swings are very versatile in our therapy clinic. So we can use them for a lot of different activities, but they also have a lot of foundational qualities. So the main thing that you're looking at with a swing is the vestibular input that you receive from it. Vestibular input is foundational to our posture, our body coordination, our two sides of our body coordination, pacing, timing. It also is core to focus and attention. So when we're working with our vestibular system, we're working on a lot of not only sensory motor, but also some social emotional pieces that we see as well. And depending on how you set things up around the swing, you can also activate the proprioceptive as well as the tactile system. So it's a very easy multi-sensory type activity that you can set up and get together.
Now, one of the things that Michelle has done with Flaghouse is develop this activity kit. It's full of all kinds of different.
If everybody can hear this computer audio, please let me know, or they can unmute themselves and speak that they can hear or know.
Toys and sensory products that really you can use together in some of the games that you've written for us to do a whole bunch of things. So tell me a little bit about the kit and why you chose the products that you did.
Sure. So one of the things that was most interesting to me when I was developing the kit was to keep it very play-based. So as occupational therapists, we work with the occupation of the client that we're working with, which in this case is children, and their number one type of work and occupation is play.
Now, I noticed one of the things that you always do in your activities today while we were going through these with the kids was you always make sure that there's a great story behind. Yeah. Tell me about the importance of having that narrative to kind of guide the child through play.
Sure. So when you're in play, both as adults and kids, actually, we hit a certain engagement state where we become very present in that moment in time. So we're not necessarily focused on maybe, for adults, what we are doing next, what we did yesterday, but for the child, really what type of activity they're doing that may actually not be very fun. It might be a little bit hard for them. So when we have a story and a really rich play base to the activity, we're getting them in this kind of safe place where they're exploring things that they may not be comfortable doing otherwise because they have this perception of it being too hard for them. So it really helps them to get into the play and into the activity in a more natural way.
Fantastic. So a couple of the activities that we did this time, we focused on a lot of, with the critter bean bags, doing things like the animal feeding time, bathing time, water rescue. What are kind of some of the goals, some of the outcomes that you're trying to achieve in those kind of games?
Yeah. So from a sensory motor perspective, we're really thinking about first, the way that the child's on the swing. So if they're laying on their stomach or they're sitting up, how fast the swing is moving through space, all of those things work a different set of muscles, different set of bilateral coordination piece to that as well. In addition to that, we're thinking about them feeling that they're taking care of somebody else, which really helps them to feel very good in an emotional way, or they're rescuing somebody. So this puts them in a position of really feeling very powerful and very effective with their bodies.
Fantastic. So we've got this wide variety of kits. You can get everything here at flaghouse.com. And if you like what we did today in this video, make sure you subscribe to the channel. We have brand new videos with experts every single week. So thanks you so much, Michelle, for having us at your place today. We had a lot of fun, and we'll see you next time on the Flaghouse Sensory Channel.
Okay, here we're back again. So I hope you enjoyed this video. Just to give you guys a little bit brief description how the occupational therapists work in an occupational therapy room with all these kinds of swings and play-based activities. Now, the next category, which is very important too, is also the motor skills development. Motor skills development is one of the core activity where children actually develop their motor skills to start their academic life. This can be fine motor, this can be gross motor. So the motor skills are common in children with autism, affecting both gross and fine motor abilities. OT utilize play-based activities to improve motor coordination, balance, and strength, like these activities. Now, again, I mentioned motor skills are actually the core element to develop to start their academic life in the schools. So mostly autism population, you will note that their motor skills will be not properly developed so they will not be able to do the motor skills challenges. These challenges could be anything like catching ball, chasing ball, or holding or passing the ball. That includes your both bilateral hand movements. So they might not able to use both hands together. They might not able to run and chase the ball at the same time because their body in the space, they don't have the idea about their body and in the space, how they can correlate both of the things together. Now, this can be also fine motor, which is mostly prescribed with the fine motor skills like pencil grasping, holding pens, coloring, cutting, beads, anything which require your finger movements, hand movements. Those are all comes in fine motor, which are also one of the elementary requirement to start their schooling life. Now, how we achieve the motor skills deficiency, how we stimulate those activities, we have lots of, again, it's all play-based therapy. It's not exercise, it's not something we treat through the medication, no. It's all play-based therapy because children love to play. Whatever we can teach them through play, they will learn it quickly. So some of the games which we normally include in occupational therapy treatment plans to improve the motor skills are obstacle courses, jumping games, therapy ball activities, bike riding, spatial awareness through tunnel crawling, drawing, cutting, pasting, beadswork. These all activities improve motor skill challenges. You can see how much they're learning in each game, like obstacle course. Take an example. So obstacle course has holding, grasping, reaching, bilateral hand movements, critical thinking. They have to do one at a time and then move to the next one. See how many activities we are learning through just one play-based activity. Okay, so these are motor skill challenges. So we'll just have a small video again, if you notice.
Sophia is 4 years old and has been coming to OT primarily for...
So this is a small short story about a girl who has some motor skill challenges and how the occupational therapist is working with that girl to improve her motor skills.
For inefficiencies with processing and modulation of sensory input. This means that her nervous system requires increased amounts of input and sensory experiences throughout the day to help her maintain a calm, organized state. The goal is to provide these children with structured sensory experiences in treatment and at home on a daily basis so they do not have to seek out input in ways that disrupt participation in daily tasks. Placing weights on her ankles and wrists allows Sophia to have a better sense of her body in space. They also work to help keep her grounded and slow her movements. Sophia also exhibits immature grasp patterns, which can lead to quick fatigue with drawing and writing tasks, as well as decreased control when using fork or spoon for self-feeding. We incorporate resistive games with Play-Doh, putty, tongs, and tweezers to assist with the development of her hand musculature and improve grasp patterns. For a greater challenge, I ask her to sustain the grasp while carrying it from one point to another. As you can see, this increases the difficulty, but turning the path into an obstacle course makes the game fun. We also incorporate reaching across midline into our sessions. This helps to develop integration between left and right sides of the body and facilitates trunk rotation. Having a strong sense of midline provides Sophia with a reference point from which she can move. Playing games on her stomach helps to strengthen her core and upper extremities. While this can be tiring, we are able to make the task motivating by using the scooter board to retrieve puzzle pieces. Like the wrist weights shown earlier, this weighted vest provides additional input and boundaries for Sophia. It allows her to have improved control of her movements as she navigates people and obstacles within her environment.
Can you find number 2?
Here, we are working on eye-hand coordination and slow, controlled arm movements, as well as more midline crossing. As the task itself is not too challenging, she is sitting on an uneven surface, requiring her to engage her core while she is completing the activity. We practice moving fast and slow during different games to help Sophia learn to grade her movements. In this game, I assist her in swinging the fishing pole fast and slow. As you can see, at this time, she continues to prefer going fast, as it is difficult and takes much more effort to move at a slow, controlled pace. Another way to organize a child's movement is to have them participate in heavy work activities, including lifting, pushing, and moving heavier items. We incorporate this into our session as a part of cleaning up activities. Lastly, we use the Bosu ball to help Sophia work on core strength and balance, as well as to slow her down and separate her arm movements from movements of her trunk. Furthermore, to provide her with additional sensory input, quick changes in head position are included within games. One way we do this is having her bend down, which places her head in an inverted position. Here you can see she is reaching for toys presented through her legs. We also work on reaching up and looking back to retrieve toys held over her head. It is important that we end our sessions with calming, organizing input. While not shown here, the last 5 to 10 minutes of Sophia's sessions are generally spent with the lights down, slow, rhythmic swinging, and breathing activities. This helps to slow her nervous system and regulate her state of arousal after all of the movement she engaged in during the session.
Thank you.
Yes, I hope you guys enjoyed the video. The purpose of putting all these kind of short videos is just to give you awareness how the occupational therapists work, because people still, when they hear about occupational therapy services, they still like to know what actually the occupational therapist does with the patients or with the children with having problems or issues or disabilities. So that's the purpose. Keeping that in my mind, I just put some this little small videos just to help you guys understanding about occupational therapy work with the autism. Now, another challenging issue is the social and cognitive skills with autism. Social communication and interaction challenges are hallmark features of autism. OT facilitates social and cognitive skills development through structured play activities, social stories like role play scenarios, turn-taking games, group activities. Yes, so occupational therapists work in group activities too. The group activities actually give a lot of participation and give them understanding how to behave, how to respect, how to wait for their turns. And we design the group according to their disabilities, according to their ages. And then we make a structured plan, a structured play-based activity that can be achieved on a certain time period. So this can be done in a group so they can learn how to socialize properly. Okay, so this is about social cognitive skills. We can skip this video. So I'm trying to, I will skip this video because it's going to take a little bit longer. Well, let's move to the emotional regulation. This is also one of the very core element that you're going to notice in autism, how to regulate their emotions. Autistic child struggles with emotional regulation, leading to meltdown, tantrums, and difficulty with coping with change. OT will assist child to learn self-regulate and cope with sensory and emotional challenges like relaxation technique, visual schedules, sensory tools like stress balls and weighted blankets. So there's lots of other ways too that we try to make them learn about how to regulate their emotions. It's a very important aspect of their life, and they should know how to control their emotions, how to regulate their emotions according to the routine life. Now, last category is the daily living activities, which we all normally have to perform and all day, which can be dressing, eating, bathing, showers, toileting, transferring. These are all daily routine activities which we require core elements of our body. Sometimes child are not able to perform these activities to their child age, and then they need to learn about these activities. So occupational therapists help in these daily routine activities too. Okay. So this is all about the main goal of an OT for autism is to improve quality of life through intervention to gain independence, confidence, focus on academic tasks, maintain and foster relationships, work with others to achieve a common goal or purpose, learn to delay gratification, express emotions in a healthy, productive way, and manage self-regulation, impulse control, and feel less anxious. So this is all about occupational therapy. Again, if you notice any changes which are not appropriate to their relative age, please consult to the professional, consult to the occupational therapist, consult to their teachers if they are noticing too about the same issues that the parents are noticing. Do not delay it. Come to the professional, get the professional advice, and get the treatment start right away. So I hope this small webinar give you some more knowledge about how the occupational therapists work with autism. If you have any questions, you can always contact on the same media plan and then let us know. Okay, thank you again. This is Sadaf, occupational therapist, and see you again.